great pleasure to introduce Dr. Ahmed. Dr. Ahmed Abdullah, he is from Khartoum in Sudan, which is one of the places that the Bird Academy also runs courses. And he's a very good friend with our ambassador there, Dr. Salah. And he's going to tell us a little bit more about that. But I wanted to tell you that he is a member of the Saudi Dental Society, the Sudanese Dental Society, and also the European Laser Dentistry. And on top of that, he also runs workshops on lasers. So we're hoping your presentation will be another treat for us in the laser community. Welcome with us, Dr. Ahmed. We have Dr. Waleed with us too. Can you hear us?
Yep, I'm with you.
Hi, Dr. Ahmed. How are you?
Hi, Dr. Waleed. How's everything?
Yeah, but we need to see your video, the cameras.
Okay.
I can't see you. Please, yes.
I'm gonna stop sharing my screen now.
Yeah.
Ahmed, and you can share yours.
Yeah, now we can see you, Dr. Ahmed. How are you doing?
Yes, I'm fine. How's everything?
How's everything in Saudi Arabia?
Yeah, fine. You know, with the lockdown, everybody is at home between the walls. I'm trying to enjoy the lectures, the conferences. To be honest, really, Bert did a great job for us for the last 2 or 3 weeks. I imagine without it, we cannot. It will be really more difficult than. But it's fine. It's fine. The point is how to use this free time. For myself, I thought really I used these 3 weeks in a good way. Yeah.
Okay, great. I have the pleasure to have you here in this platform.
Me too.
And I think many, they are waiting your presentation. It's a very interesting topic, especially here in the Middle East, in the Gulf regions, about the depigmentation. Especially you are comparing two technique or two laser wavelength. So you can start, Dr. Ahmed. Go on.
Sorry. Okay. The first of all, as you mentioned before, it's a matter of sharing the knowledge and at the same time sharing a fun time. As you said, I'm coming from Sudan. Okay. And I'd like for the next 3 minutes to share this Sudanese folkloric music. So please, if you give me 2 minutes to share this music, please.
Dr. Ahmed, I think you need to share the sound of your computer. And more, in the panel of the Zoom, in the more, press it and look for share sound of the computer. Did you get it?
Mm-hmm.
Because Dr. Ahmed, we don't hear the music, just we see the video.
Just we see the picture.
So you need to share the sound from your...
Yeah. Okay. So tell me, please.
And Dr. Ahmed, can I just quickly remind you, we're trying to stick to the schedule of 20 minutes.
Yeah. I will be at time.
إفريقيا مكاني، زمن النور والعزة زماني.
إفريقيا مكاني، زمن النور والعزة زماني. أرض الخير إفريقيا مكاني، زمن النور والعزة زماني. إفريقيا مكاني، زمن النور والعزة زماني. جنودي جباههم عالية، جباههم عالية، جباههم عالية. مواكبنا تتراجع تاني، مواكبنا تتراجع تاني. أجيب قدام وأقول للدنيا
أنا سوداني،
أفريقاوي
نيني. أنا سوداني،
أفريقاوي نيني.
أنا سوداني.
أرض خزاين فيها جناين، نجوم عيون للخير بتعاين.
قمر بيضوي ما بغيب أبدا، دايما باين.
قمر بيضوي ما بغيب أبدا، دايما باين. قمر بيضوي ما بغيب أبدا، دايما باين.
أنا سوداني،
أفريقاوي نيني.
أنا سوداني.
I'm of African origin.
أنا سوداني.
أرض الأبوة، the land of bounties. Come out to life, you bound to glory. إفريقيا مكاني، زمن النور والعزة زماني. جنودي جباههم عالية، جباههم عالية، جباههم عالية. مواكبنا تتراجع تاني. Parades of pride marching to glory. I stand up front and boast so proud to tell my story. I'm of African origin.
Sudan is bleeding.
I'm of African origin.
Sudan is bleeding. واشرق نور لقت شمسين.
Okay, you know, when I'm talking about, we're going to talk about the beauty, which is depigmentation. That means I need to talk about my country and present my country in the good way. As I said, we're going to talk about the depigmentation or depigmentation with the laser. That means aesthetic. Okay. So what is aesthetic is the science of the beauty, which is particular detail of an animate or inanimate object that makes the appearing to the eyes. For us as a dentist, or even for the patients, there is a three corners for the smile: the teeth, the gingiva, and even the border of the lip. Okay, we're going to talk about the gingiva. What is hyperpigmentation? Simply, it is a benign condition which is occurred due to excessive melanin deposition. Could be physiological factor or pathological factors. It's located in the basal and the suprabasal epithelium layers. Clinical pigmentation may not be a medical problem, but it can be a cosmetic concern of the patient. So that's mean most of the patients, once they come to the clinic, they are complaining of or their aesthetics, especially when they are smile, whatever, if they are a female or male. Okay. There is even, well, when we talk about the melanin, that means we're going to talk about the melanocyte. Some of the people, they thought that the melanocyte in the dark people is more than the white people, but the reality is not that. Both of them, they have the same melanocyte, but the difference is in the activity of both melanocytes. What is the causes of the hyperpigmentations? As we mentioned, it could be a physiological factors, could be a pathological factor. Okay, today we're going to discuss about the physiological. Okay, but most of the patients, they have this kind of pigmentation in their gum, but it's gradually different from person to the person. Especially, except the Albion people, they have a problems or disorder in the melanin distribution. Okay. This is nice thing that the female and the male, they have the same pigmentation. No difference in the significant between them. Both of them they have, so they are equal. Finally, they have something equal. Okay. It's common in the African and the Asian people. The attachment is the most common site of pigmentation. Quickly, we talk about the pathological gingival pigmentation. You can find it in the patient with the endocrine disease, heavy metals, Kaposi sarcoma, drug-induced, looks like a chloroquine. And nowadays, everybody talking about the chloroquine, that it could be the drugs for the treatment of the corona. For me, hopefully, it will be the drugs or the treatment. So after that, we can have a lot of patients with hyperpigmentation. Okay, even the smoking, if we talk about continuing the pathological factors, the smoking associated with melanosis, hemangioma, nevocellular nevus, oral melanocanthoma, and even mucosal melanoma, and the last HIV or melanosis. Okay, this is slide show the gingival tattoo. Let me tell you something about this slides. In some tribes in Africa, the female with the pink gingiva, they consider her as ugly girl, and nobody will get to marry with her. So for that, they try to do tattoo for her, and as you can see, it's really painful procedures. They start to perforate in the gingiva, and after that, inserting the tattoo. So imagine people searching for a depigmentation. Some of the people searching to do the tattoo inside the gingiva. Okay, another thing, even this is interesting cases. Some of the people, they try or they do the tattoo in their lip related to the devotional reasons or something. Some of them, they have a belief it is for the cosmetic. But imagine one of the partner decide to separate from her. She will have just two options. Even to cut her lip, definitely she will not do, or other things. She need to find somebody has the same name. Did you see the Vishiko movie? I think it will be the same to find somebody has the same name in the lip. Okay. Okay, let's jump to the gingival techniques, the depigmentation techniques. We can make removing for the gingival pigmentations. We can make masking for the gingival pigmentation. If we talk about the removing, it could be surgical method or chemical method. For the surgical method, it could be by the scalpel surgical technique, or by the burr abrasion, or by electrosurgery, or by cryosurgery, or by radiosurgery, and even by laser, which I'm going to talk about it. And I hope I can, maybe the time we're going to be limited, but I will try to cover more the important things in this technique. We have even the chemical method. It's a kind of agent, 90% phenol combination with the alcohol, and they put, but nowadays it's prohibited. It's no more because they found it's a carcinogenic. Okay, we'll jump from the conventional techniques because of the time. Okay, this is the mask of the gingival pigmentation. They have a special material to cover the pigmentation. Could be through the pre-gingival graft, or it could be through the acellular dermal matrix. Okay, we talk about the lasers. I have an important point. I don't know if Dr. Iman before me mentioned about it. Actually, I feel sorry that I did not catch his lectures. Before you buy the laser, you're supposed to go for a good training. Believe me, I know a lot of companies come to your clinic and they said, please buy this laser, it's a magic tool. Just press, no need for anesthesia, less pain, the patient will be happy. Even if you ask this guy or the representative what kind of wavelength, you don't know, just will tell him. على قولهم خدها وديلي. تمام؟ And nobody will get to know, please, you're supposed to go for a good training. It's an amazing tool, but you need to go for a good training. It's not a matter of workshop for 1 hour or 2 hours, 3 hours. Please try to find a good training center with a good instructor. If you do that, believe me, you will feel amazing. You're going to do amazing treatment. Okay, so what is laser? It's a light amplification by stimulated emission of radiation. We use it a lot in the dental. Actually, the laser is my baby. I'm working with it since 15 years. Most of the cases I do with lasers, but that not mean it's replaced the conventional technique. Nobody can tell you that. It's work as adjunct tools to the conventional techniques. Okay, quickly we're going to talk about the type of lasers. We have a solid, gas, excimer, dye, and semiconductors. Okay, we have a different type of laser which we use it in the dental clinic: argon lasers, carbon dioxide lasers, diode lasers, erbium family, could be erbium YAG, could be erbium chromium YSSG, could be Nd:YAG, could be helium. Today we're going to talk about the erbium family, or erbium YAG actually, and the diode. So even if it is 810 or 980, and the erbium YAG, it is 240. This is the crystal which we found it in. We say there is a solid state. This is the important point. Why is the erbium YAG laser is expensive? This is one of the things which make the erbium YAG laser expensive. This kind of precious crystals. Okay. Okay. Even another things. You're supposed to know what is biophysics before you touch your laser. Okay. I will simplify the things because of the time. Let's consider that the laser is the donors, which type of lasers, and the receptor is the tissue. Okay, the donors is the laser. It could be erbium YAG, could be Nd:YAG, could be diode lasers. We will talk about just today diode lasers and erbium lasers, and the other side the receptors, which is the tissue. Okay, tissue elements. We call them chromophore. Looks like a hemoglobin, melanin, hydroxyapatite, and water. Every chromophore from this, let's say she has a special love to one of the donors, but that's not mean it's hate the others. Could be a friend with the others, but it's have a love with a specific kind of laser. Okay, this is diagram. You're supposed to know this diagram. It shows the different type of lasers and in the same time the element tissue. As we mentioned before, hemoglobin, melanin, hydroxyapatite, and etc. Okay, if we talk about laser treatment, is based on the conventional conversion of light energy heat through the process photothermolysis. We have 4 kinds of interaction with the tissue: reflection, scattering, absorption, transmission. Most of the cases we were going to talk about the absorption. Okay. First case, the depigmentation with diode lasers. The diode lasers, actually the melanin, it is the love swap the diode. Let's make it simple. Okay, and most of the melanin is absorbed by the diode laser, so we use it a lot in the depigmentation. Okay, let's start with the case. This is first case. This patient came to my clinic. He's complaining from this kind of pigmentation. He's heavy smoker. He was planned to marry, and he said, "Please, doctor, if we remove this black things, which is the depigmentation, I will get into marry soon. What's this make me really shy?" Okay, we start the procedures with the diode lasers, 812. Okay, to be honest, I don't believe in the fixed or constant setting. If you know how to use the laser, you will gonna to play with it. Looks like your toys. Okay, but I believe most of the lasers now it's used the pulse mode. No more now in the market in the continuous way. Really we use maybe the people in the maxillofacial they use it, but for us to be in the safe side, I prefer to use the pulse mode. Okay, let's jump. Okay, some of the people they hear about something what we call it laser tip initiation. So what is laser tip initiation? As we know, the diode laser is deep penetration in the tissue, but in this case, looks like depigmentation or whatever. Let me make it again simple. If you want to cut, make this kind of laser tip initiation. Put the tip of the laser. You can put it in these things, or you can put it in any dark paper. Okay, it's going to accumulate the heat and make look like a carbon in the tip of the tip. Okay, of the hand. Okay, and after that they were not going to have any penetration, deep penetration of this laser. So after that, all the power of the laser will be accumulated in this tip, and then after that you can cut whatever. If you do depigmentation, gingivectomy, mostly the only treatment which we need not to make initiation, the endo, because we need to penetrate of the light in the lateral canals or in the main canals. And sometimes if you do apicectomy and you want, or even some cases of the period, if you do with the deep pocket. Okay, we're gonna jump. Okay, I use the tip of 300. Okay, you're going to find this look like a Shopee. So, okay, this is the case after. Okay, this is after 8 months. You can find it's really a big different change before and after. And really, the patient was happy, and he did marry, and even he started to bring his wife to my clinic, and he's really appreciating what we did before after. Okay. Another things, depigmentation with erbium YAG. Some of the people they say no. We say that the erbium YAG is absorbed by the water. So how can we get to do this kind of depigmentation technique? But all of the tissue it has water, and the erbium YAG is absorbed, a good absorber by the water. Okay, so you can maybe the procedure will be really superficially, but even you're going to increase the water as external source. I will going to show you now in the movie. Okay, I believe in laser. I believe in erbium YAG more than that. Believe me. Okay, I will going to talk about now. Okay, for the patient, if you make a comparison, the erbium YAG is better because with the erbium YAG you don't need any kind of anesthesia, because you don't have any kind of thermal damage or high thermal. You use the water, you have a cooling system, and in the same time, sometimes you could have a bleeding. Okay, but with the new technology, they start to play in the setting, what we call it the mode, pulse mode. They start to make it more time. Okay, that means will decrease the peak power, and in the same time there will be more thermal effect. Okay, this is one of my interesting case. It was the first case which I did for him. The depigmentation. It was 15 years back. Okay, I did use this kind of Arabian Yak lasers, okay, with non-contact handpiece. Okay. Some of the people at that time, they said, no, the Arabian Yak will not work. To be honest, I take it as a challenge, okay, especially with this difficult case. I did not use any kind of anesthesia. Okay, sometimes no kind of any periodontal dressing. Okay, the patient, sometimes maybe it's slower than the dial lasers, but believe me, if the patient leave at home and he have no any pain, he can come once, twice, no problem. Unless that he has no pain, no severe bleeding, no any kind of even of painkiller or something like that. Okay. For this case, I did just for the upper to see what will be the result. I did just the upper in the beginning. You can see how is the difference from between the upper and the lower. Okay. After that, we continue for both upper and lower. If you can see after we finish the upper quadrant and after we finish both. Okay, wherever I have this belief. Okay, another case. This is one of the students of the laser. Now he is doing his mastership in Germany. He usually joins me in the clinic. Okay, this is another case. Even you can see high depigmentation. Okay. This is the new baby for me. I believe, as I said, in Arabian Yak more than any kind of laser. The problem of the Arabian Yak is, to some extent, it's really expensive, but it's really amazing tool. I call it the Rolls Royce of the laser. Okay, use again non-contact. Like quickly, this is the movie. You can see that we make ablation. Okay, and you can see that this is the green light. It's not laser because the laser is not in the color or in the you cannot see it. Okay, but they fabricate what we call MED to guide you where is the laser. Okay. Thank you very much. It take more time.
Thank you very much, Dr. Ahmed.
Your voice, Dr. Ahmed. Can you lower it down?
Yeah. Okay.
Dr. Ahmed, we loved your introduction. Everyone saying how beautiful was, nice break, nice Sudanese music at the beginning of the lecture.
Okay.
Thank you also for having an overview of management of depigmentation and the importance of that. It's such a huge topic, and I'm sure people can get in touch with you.
Okay, quickly, just say like, if you give me 1 minute, that's regarding the cases. This is another case. Okay, we'll go quickly. Okay, this is from my countries. Okay, I believe my people, they are great people, and this photo during the revolution in Sudan last year, really we have amazing. We have a unique people. We have a unique people. Okay, I will go quickly. Blah blah blah. Okay, I like everybody to read the articles. This is one of the nice articles which I did really read it yesterday. It is for the Rajul al-Mushaghab, Dr. Manaf. It was it is really great paper. Okay, special thanks to the Bear people, from the people from Sudan, Dr. Salah, Allah, even the people that sent to me these photos. Special thanks to Dr. Hassan, special thanks to Dr. Walid, special thanks to Dr. Tamer. Okay, special thanks to Dr. Zaid Al-Ani, the king of the occlusion. Okay, the queen of the bird, Solange. Okay, Victoria. Everybody, when I go and I tell them I know the Bear people, they tell me, oh, you know Victoria? You have a good reputation somewhere.
No one mentioned Hassan, huh?
So Dr. Hassan, you need to keep her, don't leave her to go anywhere. Okay, this is the Bear people, the graduation. Thank you.
Can I
Thanks
ask
a lot
for a
for
favor, Ahmed?
Yeah.
Ahmed, you are, you know, a passionate laser dentist, and I think from your lecture we could see you believe in that. And we're very sorry that we had to interrupt you, but because we have a strict program we have to follow. Is it okay if you type your email address? So if anyone has a question or they want to have notes of your lecture, they can get in touch with you directly, and then you and them.
My pleasure.
Can,
My pleasure.
because
I love the education.
your
Fast
lecture.
educate. Yeah. Yeah. This is
Excellent.
our
Thank you
mission.
very much.
Thank you. Thank you. Have a nice day.
And regards to all our friends in Sudan, regards to Bird family in Sudan, Dr. Salah and the fantastic work he's doing there to spread education in Sudan, and to you as well, our good friend Dr. Ahmed.
Thanks a lot. Looking to see you soon in Sudan. Thank you.